This vaccination program represents the most significant national mobilization program outside of probably an election day activity. So what we have behind us is 75,000 doses of the AstraZeneca COVID-19 vaccine. But this represents our third shipment. The other two shipments coming from India in the first instance as a gift from the Indian government. The second shipment coming from the COVAX facility, which is a WHO PAHO facility for countries that have made a collective purchase. And this third shipment coming courtesy of the government and people of South Africa and the African Medical Supply Platform, which is a similar facility to COVAX, but based in Africa. So this shipment is coming from Ghana, but coordinated out of South Africa. So I want to use the opportunity to thank the government and people of South Africa, but also the African Medical Supply Platform. And this shipment is going to be used for our Blitz exercise starting this weekend, as early as tomorrow. We're going to be dispatching from this evening. And the intention is to inoculate as many persons as possible, hopefully well over 50,000. We are doing 60 years old and over, and we are including now our teachers, and we're also including our hotel workers. We'll be setting up sites across the country. In every parish, persons can now make appointment. We will waive the curfew restrictions for this weekend for persons who are going to get vaccinated. We have another shipment coming in this month from COVAX, approximately 50,000 doses, which should come in about the third week of April, and possibly another shipment for 20,000. So I think as a country we are making progress in terms of finding the supplies. Though they come in small portions, it's still helping us to continue the program, and we're very grateful for that. I think we have made good use of the vaccines we have received. Wastage rate is very low, well within the acceptable limits. We have corrected any hiccups that we have experienced or encountered.
For example?
Well, for example, persons coming in who were not supposed to. Whenever we discovered that, we would shut down those sites, start back up. And if you look at the audit of those who have received, it's a very small percentage. I think less than 1% of those who have received outside of the category that was supposed to receive. So I think from that perspective, we have done well. We would like to see more take-up. So there is vaccine hesitancy, and we're going to have to play a more effective role in communicating the importance of the vaccine. But I would say so far so good. The Blitz, to my mind, were overwhelmingly successful. The first one, we had over 600 persons, even though we targeted 1,000. But for me, it was more a learning experience than it was just delivering the numbers. Again, we engaged additional support to mobilize, because what is very clear is that it is not just about providing a facility or vaccines and people will come. It's also very important about convincing people why it is important, answering their questions, overcoming their objections and queries. And what we have therefore done is expand from week 1 into week 2 by adding the members of parliament. Now we're going national, adding the councillors and the other groups. And I think that will make, I think, the process more effective in terms of mobilization. Now, the real challenge, given that we are now spread out across the country, have many sites, is of course controlling for quality and delivery of service. It's not a concentrated effort. So this week is still going to be a learning experience, but a number of us are going to be spreading out across the country. I think this is going to be, this weekend, what I would consider the real test of a national mobilization program. And I've been on record of saying that this vaccination program represents the most significant national mobilization program outside of probably an election day activity. It's a lot of work. It involves many moving parts, and so there's always going to be a margin of error here and there. But I'm confident that the people involved know what to do, and they're committed to the work. The AstraZeneca vaccine allows for a second dose to be administered between 8 and 12 weeks after the first dose. Everyone that has received the vaccine has been given a card and it has been logged as to when they got it, the first dose, and they are going to be notified around the time for the second dose. But we should start administering second doses sometime in May, early May. So we're very conscious of what we're receiving to know when to hold for second dosage. And that data is tracked, monitored, and then we reach out. We are, however, seeking to increase the proportion of Johnson & Johnson. And we're now in deep conversation with manufacturers to see if we can change out to Johnson & Johnson, which is a single-dose vaccine. And the reason for that is that having a single dose is far better to administer than having someone go and then have to come back. There is no certainty in this thing, right? The reality is that we operate with ideals and we work towards them. If we fall short, we try to change the strategy and we try to encourage. And it's certainly my desire that Jamaicans sufficiently appreciate the need for vaccines as an important response to take up. But the truth is, I am a realist and I do appreciate that some will not, which is why we set a 66%, 2/3 target, recognizing that a third would not. It may be less than or more than a third, and we'll determine as we go along. The key is going to be just to continue to sell the messaging around the value of the vaccines. Higher than 80% of the numbers of deaths are linked to age and comorbidities. So the logical strategy is to ring fence those persons to give them some protection through the vaccines, so which is why we target them first. I believe that over time, what you will see is a more challenging task to get younger people to take the vaccine. But if we ring fence the older people, it will minimize hospitalization and deaths. And that's really what you want to achieve. I think the last weekend lockdown has been more success than failure. I think the roads were relatively empty. I think persons used the opportunity for rest and relaxation. And yes, many went to resorts, which I think is allowed. We had our team out in the field examining many of these resorts. And for the most part, the reports that I have suggest that persons observe the protocols. These hotels do have protocols. The sanitizing stations, the spacing out of chairs around dining tables, the mask wearing and so on. And the reports that we have had is that for the most part, persons have complied. Where persons fail to comply, then I think the law has been more effective, or the enforcement has been more effective this time around. The police statistics suggest that a number of persons have been detained. With the new ticketing system, you'll see more of that. So I'm not suggesting that you did not have breaches, because there's no perfect system or process. But I think this last weekend I believe, would have been better than most. The numbers are suggesting that the rates are coming down, hospitalization are coming down, and the reproductive rate, which is the most important number to watch, has dipped just below 1, which is good. We really want to get it down to about 0.7. So the measures have been working, but we are still in a very delicate situation.